Good morning, everyone. My name is Shannon Morris. I'm a senior program officer here at Health Forward. I'm co-lead of the team. You're going to be hearing more from me shortly. But before I hand it over to our CEO, President Kiana Thomason, for some opening remarks, just want to do a quick review of the agenda. Following Kiana, I'm going to give a little bit of a background on Health Forward. Followed by that will be Donna, and she's going to do an overview of the mental health RFP. Following that, Associates Corey Stites is going to review the application process. And then following that, the one and only Karen Guile is going to provide a tour of our new grantee portal. We're super stoked about that. Hopefully you will be too. Following that, we're going to have a question and answer portion of the presentation. Feel free to chat your questions. Feel free to just speak out and verbally ask them. And we'll do that during the question and answer portion of the presentation. And then we're going to have a quick break. And then following the break, we're going to have a breakout room discussion. We've heard from a lot of grantee partners that there's an interest in more opportunities to engage with one another. And as a result, we've carved into the agenda today some time for some breakout room conversations to afford you the opportunity to do just that, to engage with one another. Health Forward, all groups will have a Health Forward associate present. We've developed 3 questions to kind of facilitate the conversation. More to come on that. We'll share that with you later in the presentation. But before we go any further, let's pump the brakes here. I want to hand it over to Kiana Thomason for some opening remarks.
Okay, thank you so much, Shannon. Can everyone hear me? Okay, great. I've been having Zoom audio issues, so if you see me twice on your screen, I am on my phone. Good morning and welcome to Health Forward Foundation's 2021 Mental Health Pre-Proposal Conference. Again, I am Kiana Thomason, President and CEO of the Foundation. Whether you are an established partner or a new organization exploring this funding opportunity, thank you for your interest in partnering with us to improve the mental health and well-being of our community. I also want to thank our dynamic mental health tag team, Shannon Morris, who you just heard from, and Donna Bashore, Corey Stites, our program associate, and our grants management team led by Karen Guile for their thought and planning that went into making this an informative opportunity for information exchange. Pardon me, I just got an alert to unmute myself. Can you still hear me? Just want to make sure. Okay,
yeah,
all good.
Yeah, you're good.
All right, thank you, Corey. So I was reflecting on last year's pre-proposal conference, and 1 year ago, we were gathered in person for this conference at the Kauffman Foundation Center. And if you recall, our keynote speaker, Dr. Moria Mulhern, shared best practice principles for cultivating and sustaining resilience. Resilience in those we serve and for ourselves as clinicians, administrators, fund developers, and leaders in this field. I think that that was such a fortuitous call for us as we've grappled with loss, isolation, separation, community care, and self-care, most importantly, as we're nearing a full year of this COVID-19 pandemic. So we are thankful for the prospect of partnering with you as we together and with those we serve fortify the resilience of our community through mental health treatment, advocacy, and support. Your work is more important now than it's ever been before, and if you've not heard it enough from those you serve or those you work with, thank you, thank you, thank you to you and your organizations. You've been holding our community up, holding our community down, whatever nomenclature you want to use during this very challenging time. So appreciate you all greatly. Before I pitch it back to Corey, if you've been following the foundation, you know that we will spend all of 2021 in purpose alignment. It's what we call strategic planning. And during that process, we'll be working to deepen our commitment to equity within that plan. So stay tuned for announcements of community-based focus groups where we'll have the opportunity to hear from you to inform that plan. So with that, I will pitch it back to Corey to get us going, and welcome.
Thank you, Kiana, and I will actually hand it back to Shannon.
Okay. Good morning again. It's good to see everybody. Those that I can see anyway, still getting used to this whole new format. I hope everybody's hanging in there. I'm going to jump into the presentation in just a second. I just wanted to take just a few moments, just like Kiana, and just kind of share some reflections on where we're at the last year and that sort of thing. To complement what Kiana said, we did this about a year ago. It was February 12th, 2020, to be exact. I remember it last year, pre-proposal conference. It was a snowy day. I remember I was really excited. I was excited because we hadn't had a mental health pre-proposal conference the previous year. I believe it was Kiana's first pre-proposal conference with Health Forward after she joined. With excitement about that. There was a good breakfast. We had bacon. It was very good. Just a lot of positive memories and thoughts about 1 year ago, right? And who would have thought that a month later, our worlds would start changing so drastically, right? Obviously, the onset of the pandemic, and it just kept coming. The racial tensions from historic to systemic racism. We had an insurrection on the nation's capital not too long ago. So when you look at the whole year that's passed, it's been a lot going on. A lot has happened. A lot has changed since we did this previously. And though this year's version of this conference is obviously different in terms of format, after all that, here we are again, together, albeit virtually, but just like last year, here we are. And I think that's why it's so good to see that so many people are taking time to be a part of this call. It's good to see so many familiar faces and familiar names, and some that aren't familiar, and that's great. I think the fact that so many of our friends and partners and guests that are in attendance today, I think it speaks a great deal to the resiliency of you. I think it speaks to the resiliency of the organization you represent. And I think it speaks to the resiliency of our community. And despite that, everything that's happened in the last year, all the adjustments and pivots that we've all had to make, but particularly you had to make, right? Both personally and professionally. Here you are, ready to roll. Still fighting the good fight. Still representing those in need, right? Still putting others before yourself. And so I just want to echo Kiana's thoughts in terms of, regardless of your job title, your work functions and your responsibilities, regardless of whether you've received funding from us before. If you're on this call and you're with us this morning, we'd like to thank you. We really would. We would like to thank you for all that you do. And we would like to thank you for taking time out of your busy schedule to be with us this morning. So anyway, thank you for indulging me in that. We'll get this, we'll keep going with the presentation. A little bit about Health Forward. Last year, we celebrated our 15-year anniversary. It was really, really cool, if I do say so myself. There's a lot of pride in that, a lot of energy, a lot of optimism for the future. And I think it goes without saying that we would be here today, 15 years later, if it wasn't for our partnerships within the community. Anyway, probably nothing new. Our mission is to eliminate barriers and promote quality health for the uninsured and underserved. And the vision of Health Forward is healthy people and healthy communities. Next slide, please. We serve the uninsured and underserved in 6 counties, in both Kansas and Missouri. In Missouri, it's Cass County, Jackson County, Lafayette County. Kansas is Allen County, Johnson County, and Wyandotte County. We also, we serve the Kansas City, Missouri area, so that also includes portions of Clay and Black counties. And that target area includes rural communities. It includes urban communities and suburban communities. Covers it all. Next slide, please. Funding opportunities. We're here to talk about mental health. Mental health is part of our foundation defined grants. 3 RFPs. I'll talk more about mental health in a little bit, but it also includes healthy communities. Funding for healthy communities promotes access to healthy foods and safe environments for physical activity. We have our safety net RFP. Supports the implementation of service delivery models for physical and oral health. We also have our applicant defined grant. It provides an opportunity that's based on the applicant's determination of need, as long as there's an alignment with Health Forward's mission and our target population and service area. We also have special initiatives, and these seek to address gaps or system fragmentation by bringing together key stakeholders. Sometimes these originate internally, sometimes they originate externally, all with the heavy emphasis on collaboration and partnership. Next slide, please. Okay. I've been with the foundation over 5 years now. This is nothing new. It's been part of the mental health pre-proposal conference since I've been at the foundation, and for good reason, right? So as part of the application process, grantees will be required to affirm that in providing services funded in whole or in part by Health Forward, they will not discriminate in employment practice or in policies. This includes hiring and promoting practices, as was said, board membership, and like I said, clients' access to services. Next slide. And that's going to be my cue to hand the baton over to my esteemed colleague, wonderful person to work with, and a very, very important thought partner in my life. So Donna, it's all yours.
Thank you, Shannon. Good morning, everybody. If you didn't feel welcome after Shannon's few minutes with you, I don't know what else to say. We're happy to be here. I'm grateful to be here. I'm grateful that you're here. I'm going to spend a few minutes going over the 2021 mental health RFP strategies. I will say before I get started, there's been a couple of questions in the chat. This information, everything that I'm going to talk about will be available in the RFP. This presentation, as well as more information about our theory of change, will be on our website, so you can access it there. The application package will be open very soon, but the RFP will be available to you right away. Based on the registrations, we looked at, it looks like about a third of you may be new to this process. If we were in person, I'd have people raise their hands, but to all of the new guests that are considering applying for the first time, welcome. And just know that we will provide more in-depth information in writing. This is going to be a high-level overview of the strategies.
Okay.
For those of you that are familiar with the Health Forward application for mental health,
Donna, you've been muted.
Yeah, you're muted, Donna.
you mean I did that whole amazing speech and nobody heard it? Okay, so let me
It
start
was only
again.
for about 10 seconds.
Okay, I don't know how that happened. So where did I leave off, Corey, so I don't repeat?
You were just starting to get into the RFP info.
Okay, so I'll repeat the fact that if you're new to this process, all the information will be available on our website, the RFP, the application, as well as our theory of change information. For those of you that are familiar with the process, you can take a deep breath and exhale and relax, because we've not made any significant changes from last year's process. So as I walk through, I'll also remind you that you are welcome to use the chat to ask questions, but we will have a question and answer period later on this morning. So a few years ago, 2016 specifically, the foundation developed a framework, and that framework had the intent of being more intentional about our grant round and to clarify the foundation's desired outcomes.
Donna, stop it.
Donna, we lost audio with you again.
Okay, so I'm having, let me see if I can switch to another, because I'm not sure what's going on with that. I'm gonna switch to my headphones.
Okay. Thanks everyone for your patience. It's always a challenge with these big meetings and handling technology.
Okay, can you hear me now?
Mm-hmm.
Okay, I'm gonna see if this works. I'm not sure why I'm switching on and off. Okay, so the purpose of the Mental Health Foundation defined round is to improve the availability and quality of mental and behavioral health services. This process we developed a few years ago with our theory of change framework. It is this purpose that we incorporate into the RFP and application. It is this purpose that we use to review the FDG proposals, and it is also this purpose that we try to align the reporting process and measuring outcomes. We continue to believe that with the strategies of the mental health FDG round, with measurable short-term outcomes, will ultimately impact the health and well-being of people in our community. This year, approximately 4.5 million will be available to help support our mental health purpose. Next slide. Thank you. The key deadline dates. So the letter of intent deadline is March 17th. Full proposals will be due by noon on April 14th. And as many of you know, there is a months in between when you submit before it is final with our board approval August 25th. We are encouraging you to keep track of the deadlines for potential changes to these dates. I don't know that we had this last year, but clearly after mental health had some delays last March and extended deadline dates, just kind of follow us. What I will tell you is that the deadlines won't be any earlier than the date stated. Next slide, please. Okay, the mental health strategy.
You jumped on mute again, Donna.
You're
I don't know what's happening. Some kind of gremlin that really doesn't want me to do a very seamless presentation, but we're gonna try this again. The mental health strategies continue to be focused around increasing capacity, increasing access, and improving the quality. Your proposal, the activities, the outcomes, as well as the budget must align within at least one of these focus areas. So in both your letter of intent and your full proposal, we're asking that you indicate which of the strategy areas you'll be working on and requesting Health Forward funding. Again, the theory of change is described in the RFP. Next slide, please. Can you still hear me?
Yes.
Thank
good.
you. Okay, I'm going to test it now. The mental health theory of change. So as I said before, we have developed strategies for our mental health RFP. These strategies are based on the fact that we have guiding principles that if these strategies are employed, we should be able to see some impact. You will see in the RFP under each of the strategies, these several bullets. We are not expecting you to approach all of these strategies. It is acceptable to work within more than one. So if you are working within improving access, it is acceptable for you to approach a couple of these. So if you're working on policy, you may also be working on improving coordinated care.
You've been muted. You're back.
Okay,
You might want to call in, Donna.
I might have to. I'll do that and try to talk at the same time so I don't
Yeah.
delay your process. Okay, so where I think I was telling you that you do not have to approach all of these strategies. There's no funding advantage to employing more than one. And there's not one of these strategies that's prioritized over the other. We really want you to focus on what your project is able to measure and do within the time frame. We assume that you are working on all of these as your normal course of business, but ask that you focus on a particular strategy or strategies for your proposal. Next slide, please. Can you still hear me?
You're good, Donna.
Yes.
Okay. Outcomes and evaluation. Hopefully I don't get muted on this because this is important. The outcomes and evaluations, as always, in your proposals, we want you to really be able to address the key evaluation questions. So how will you know if your project's successful? How do you measure success as an organization or within a project? And are your outcomes realistic and measurable? So our typical grant duration is 12 months. And so we are looking for those proposals that have a realistic measurement framework for a 12-month project. We understand being able to intervene in mental health and behavioral health is a complex and often long process. But for this application process, please be thoughtful as you explain how you measure success. We also want to know how you're using the data, lessons learned, how this impacts your service delivery or the people that you're working with. The foundation short-term outcomes are the outcomes and indicators that we hope will allow us to better record the outcomes of our partners. And also we use those aggregated outcomes so that we can tell a better story about our grant making. You are not expected to align with all of our short-term outcomes, but you should be addressing at least one of the outcomes in your proposal. Next slide. So given my technical challenges this morning, I'm sure this is going to be like the most important slide, and that is Shannon and I are available to have consultations where we can brainstorm, clarify priorities, fill in the blanks of what was missed out while I was muted in this presentation. We cannot read your proposals. For those of you that know and have met with us before, sometimes this is helpful just as a thought partner to think about your application prior to submission. We have a new email address that we're asking that you please use to schedule those calls. So if you email us at mentalhealth@healthforward.org, it helps us better organize and respond much quicker to your request to have a virtual meeting. We will have consultations with you up until April 9th. After April 9th, we really want to be able to focus on the process and the incoming proposals. So now, well, not now, let's say starting tomorrow through April 9th, you can start emailing us at mentalhealth@healthforward.org to request a consult. Any questions you have regarding the application, the portal, budget questions, technical questions, those you are free to reach out to any one of the team and ask up until the deadline submission. At this time, I'm going to turn it over to Corey and Karen to walk through the application process. Thanks for your patience.
Thanks, Donna, and thanks for sticking it through those challenges. I think people heard all of the important stuff, and of course, we're available to answer any questions that didn't come through. So if you're not familiar with our process, our application process is a two-step process, starting with a letter of intent and then your full proposal. The letter of intent is required in order to be able to submit a full proposal. So make sure that deadline's on your calendar. The LOI isn't competitive. It's not an approval or decline situation at that point. It's really just for our information to know what sort of applications we're getting and to give us the opportunity to reach out to you if we have any concerns about what you're planning to propose. Let's just get in touch with you to make sure you're making the best use of your resources and addressing the RFP directly. Some other tips, we do, as mentioned, we do work in an online system, and we do, we always encourage you not to create your content there. Use the templates we provide to come ready. I know a lot of the grant writers in that room might have had that experience of writing something awesome and then you lose internet connectivity or it doesn't save and it's gone. So use those Word documents we provide for you. And you can go to our website to download the full application package. That's going to be available here in mid-February, so you won't have to wait too much longer here. Karen Guile is going to show you a demonstration, including where to find those on the website. But the full application packet for your full proposal will include a narrative template, a budget template, online application instructions and forms, as well as an optional outcomes and indicators matrix. And again, that LOI should be open in mid-February. Wanted to touch briefly on two common attachments that we encourage, the letter of commitment and the letter of support. A letter of support is a great thing to have from organizations that will benefit from the program, that maybe you're referring to or receiving referrals from, partners who are excited about the work you're doing. Whereas a letter of commitment is required if you have a partner who's going to say receive some of Health Forward funding, as part of their role. Or maybe they're contributing something significant like in-kind resources or other resources that are contributing to the project. So in that case, we would ask you to make sure you get a letter of commitment outlining their role, any dollars they'll receive, and explaining their commitment to the project you're proposing. And I wanted to touch briefly on some additional resources that are available to you. I really encourage everyone, particularly if you're newer to the foundation or to this round, to take advantage of all of these that are available to you. This first one, grant writing technical assistance, is available for organizations with budgets under $500,000. So we're really targeting some assistance to smaller organizations. And we will provide up to 8 hours of grant writing consultant time. So, that's a great opportunity to have a professional grant writer review what you're writing and provide feedback to help make your proposal stronger. They obviously won't be able to write the full proposal for you with just 8 hours, but it can still be a big help. And those grant writers are familiar with us and each RFP round, as well as experienced in grant writing generally. And Donna mentioned that important opportunity to connect directly with program officers, with Donna or Shannon, and brainstorm proposal ideas. And again, you can email that mentalhealth@healthforward.org is the best way to get in touch with them and set that up. Another great opportunity is to review exemplary proposals. So those are grants that our internal and external reviewers thought really hit the nail on the head and did a great job of explaining the need and outlining the program and value, just top marks all around. And so if you email grantsadmin@healthforward.org, they will pull some proposal for you to review, often tailoring it to the type of program you're proposing to try and make it as relevant as possible. And with, of course, any private information redacted. But that is another great way to see what a good proposal for Health Forward looks like. And I wanted to mention too that for organizations who don't meet the requirement of having an annual audit, so that's maybe a lot of smaller or newer organizations, we do have fiscal agent services that we can link you up with. That's not something you have to have lined up before you apply. We can handle that after you've been awarded, but just know that that's available if you need it. And if you have questions about that, you can reach out to us as well. And with that, I will turn it over to Karen to share a little bit more about our application process.
Good morning, everyone. I am Karen Guile, and I'm going to spend a few minutes this morning walking you through our the technical aspects of our application process. It's really good to see your little tiny faces this morning. It's better than not seeing you at all, I'll tell you that much. So when you start your application process, you're going to want to go to our, first of all, can everybody see my screen? It should be our website, partnering for, thank you guys. You're going to want to come to our website, healthforward.org, and you're going to want to go to grantees and applicants right here. And then you want to go to application process. And then you'll have options for whatever grant you'd like to apply for, in this case, Healthy Communities. And here is where you will normally find all the materials that Corey mentioned earlier, the templates where you can outline your whole application and get it down on paper before you transfer it into the online portal. It'll be right here under instructions and templates. There'll be a zip file here that you will click and it'll download down here, and you'll open it up and you'll see instructions folder as well as a folder with all the templates you'll need. So it's not there now because we're putting some finishing touches on them. So we invite you to look for them in the next couple of weeks. I think, Corey, in 2 weeks we said, and then so you'll be able to start at that time. For the letter of intent portion, though, you won't need any templates to upload any templates. Everything will be entered online. It's a very brief proposal. So now when you're ready to get into the portal and start your online application, you'll see there's this section here on our website called Grantee Portal. and you can access the grantee portal here. I also wanted to point out right here at the bottom of the page are some instructional webinars. There will be a virtual tour here we have recently refreshed our grantee portal to provide a more attractive user interface and enhanced functionality for you, which I'll demonstrate in just a second. And also the slides and the webinar from today will be found here at the bottom of this page. So to access the grantee portal, you click here, and I'm just going to cheat because I already have it open. And you'll go into login. I was looking at the participants here today, and I noticed there are a lot of names I didn't recognize, and I think there might be some people who have never applied before to Health Forward, which is excellent. I would encourage all of you, anyone who has never applied to Health Forward in the past, I think it'd be really great for you to reach out to our grants team so we can schedule a brief orientation of the application process for you, so there aren't any surprises, or you know what to do if you face a technical problem. So please reach out to our grants team at grantsadmin@healthforward.org, and you can find us on the website always. When you get to the portal, if you're a new user, you would click here and it'll take you through a series of eligibility questions, which you'll only have to answer once. And then it'll ask you to register for the portal. You enter your information, and it will send you an email to click and confirm your password. Then you're good to go. For those of you who have not applied to Health Forward, who have applied in the past, you know you have a login, but you have not applied in the last 6 weeks, I want to let you know that all usernames have been converted to your email on file with us. And if you don't, and the passwords remain the same, but if you don't remember them, go ahead and click forgot your password, and I'll send you one. Any questions you have, just let us know, contact grants admin, and we'll be able to walk you through it. And now, once you get in, you see that we have redesigned it, and it looks a lot different. And if you want to unmute right now and be like, ooh, oh, it's glorious, like, I'll take that. It'll be good. It was a lot of work. But
it's glorious.
Thank you.
Congrats.
Is that you, Kiana?
Keisha.
That's probably my colleagues on the grants team, but I appreciate it. Thank you. So we worked really hard with some really excellent consultants to provide a better user face for you guys. And you'll see now, when you get to the landing page, you'll have your applications that you can access immediately, all your open applications, but also there's these 3 main buckets. And these are the open grant opportunities at the moment. And so if you have not started an application and you want to begin one, this is where you're going to go. Just wanted to point out right here is we have an account management section where you can manage not only your own information, but some of your coworkers. Like if there's new people at your team or somebody has left the organization, you can update that information there. As well as, for those who've been applying for a year, we ask for audits, 990s, IRS letter determination with like every application. Now we only ask you to upload it once per year, and it'll be in this section. And then we'll provide you with some resources and FAQs in this section. And we'll have all our grant deadlines will be here for to help remind you. And hopefully those will be there on Monday because they just got approved by the board this week. So to start your Healthy Communities LOI, you would go to Grant Opportunities, Apply Now. And you would see the open opportunities we have at the moment. You'll click Healthy Communities, Letter of Intent. And there'll be some information about it. You're ready to start, you start a new one. And I just wanted to show you that it's really user-friendly and it's not very difficult, but I wanted to demonstrate it today because it does look a lot different. And you'll notice how it stops and spins for a second. And it's just downloading. In order to make it a lot more attractive for you, the con is that it takes a little more time. So that it's downloading information from the application and also pulling information that you might have already entered. And so it'll pre-populate here. So the application now, it used to be tabs all along the top, and now it's just a menu where you can start sections and walk through. takes a second. And so you'll just start answering your questions, save and next. And so that's it updating for you. And you just go through that way. And I just wanted to show you because it does look a lot different than it did before. And if you guys have any questions or any problems, please let us know. And, never spend more than just 5 minutes trying to struggle through something. Just always contact us because hopefully we can save you a bunch of time.
Thanks, Karen. And thanks everyone for your patience. Yeah, I've seen some comments that it's reassuring to know we're not the only ones who have challenges like this in our virtual life these days. But yeah, we will make sure that you have the information you need to apply successfully. So always feel free to reach out to us. I wanted to just clarify briefly, we've always gotten questions about our review process. And so we just want to clarify a little bit about how it works. We do use both internal and external reviewers. We consult with our external reviewers for their expertise in the field and for unbiased feedback. As a reminder, they're from outside of our service area. So they're not going to be familiar with your organization or your partners. So it's really clear to articulate that really clearly so they understand the work you're doing in your place in the community. At the same time, we also rely on our internal knowledge of the field, of the community, of our history with various applicants and grantees. And ultimately, the decision-making does lie with the Health Forward staff and leadership, of course, with the guidance and final approval of the board of directors. And with that, we will open it up for questions. We're going to try and go back and make sure anything that popped up in the chat gets addressed. But so feel free to put more questions in chat or unmute yourself to ask those.
Corey, I'd like to answer one from Susan Ray this morning. How can one review exemplary proposals with everything being virtual? In this case, you would email grantsadmin@healthforward.org and let us know that you'd like to review some proposals. It's very helpful if you tell us a little bit about the project that you're intending to apply for or to request funding for. And then we will pull proposals and email them to you. They redact certain budget information and any personal, if your board of directors or anything, there's nothing like that in there, but you will, we'll do it via email. So I'll just answer that one. And I think there was another one.
Thanks, Corey, because I put in the chat the wrong instruction, which was to email mental health at Health Forward, but either place will get you to that.
Mm-hmm.
Roxanne, about your account management and not being able to upload files. Yeah, I'm going to look into it and email you back. And so you don't have to do anything at this time, but we'll figure it out.
I see one question about when we submit the LOI, should we assume we'll be approved to submit the full application? Yes, absolutely. There's no approval process with that LOI. It's really just a placeholder for you to be able to submit. So yeah, I'd say go ahead and get started once the templates are released. The matrix, the outcomes and indicators matrix is optional this year. So if that's a helpful tool, it can be helpful to reviewers to lay out your whole evaluation plan like that. Feel free to submit it, but you do not have to.
Thank you, Lee, for that question. The logic model form and the outcome matrix form that some of you are used to seeing, as Corey said, are both optional, but they are helpful.
I had a question about from Susan Ray about, can you address any equity emphasis? And I will let our mental health team speak to that.
Sure, Susan. So in the mental health round, we have always asked for our partners to be explicit about how they are providing culturally responsive and equitable services. So in terms of the population, in terms of your staffing. Those questions continue and you'll see them in the application. That will be no different this year than it was last year. That is important as you think about who and why you are providing services and your request to us. So that's continues to be the same interest, same importance around equity. Moving forward, as Kiana mentioned, we are in our purpose alignment process, and we may have more direct questions as we move forward with the mental health round and approaches. But for right now, know that we are still in the same place where we consider providing equitable and culturally responsive services critical to success of our mental health investments.
Are there any other questions? Oh, Donna, there's one for you in chat. Has Health Forward previously funded programs or projects that do not directly provide the clinical mental health services, but do play a role in addressing gaps in access?
Yes. So the mental health is not strictly focused on clinical interventions. We fund the continuum, so from prevention to recovery across the lifespan. And so the simple answer is yes, that we fund projects that do not provide direct clinical mental health services.
And that would include policy proposals as well.
Yes, thank you, Shannon.
Any other questions? Okay. Well, with that, we are going to take a 5-minute break before we start our small group discussions. We encourage you to stick around if you can for that. I think it's, we had a similar format with our Healthy Communities pre-proposal conference, and I think it was a really good time for folks to connect and be encouraged and share. So stick around for that if you can, but we understand if you need to hop off, and we will see you back here in 5 minutes. So I'm going to prompt you to join a breakout room. Just follow the prompts on your screen. There'll be a Health Forward facilitator in your room to help guide the conversation. But and we'll ask you to designate someone to kind of record notes for your group. And as we mentioned, there will be an opportunity to share out afterwards. So with that, I'm going to send you into your breakout rooms, and you'll have 25 minutes to discuss. Welcome back as folks are filtering back into the room here.
Well, we had a great session. I have to just admit it up front. My breakout was the best.
I think my breakout was the best.
If y'all can't tell, there's a healthy, good-spirited competition that's going on at Health Forward.
Yes.
Hey, Donna, we did not get to the third question in my breakout session. Would you welcome people, if they have some strong thoughts, to maybe email mentalhealth@forward.org?
Yes, please do that. And actually, any response to any of the questions, please feel free to email us your thoughts and responses. We really do value your input.
And you can send responses to that mental health email address. Is that the best place to send it, Donna?
Yes, yes, please.
Yes, please do. Yeah.
And that just goes to Shannon and I. So just so you know, the whole organization doesn't get it. It's just an easier way for Shannon and I to communicate.
So we'll go ahead and are there folks who would like to share on that first question, examples of your organization's resiliency over the past year?
And we're just going to have folks share individually, so don't feel like that it's a group report out.
I would like to invite Sherry to share some of the stats that she was sharing in our breakout room about the effect of the pandemic on our mental health. I thought it was really interesting. I know that's not necessarily answering your question, but much of what she was saying is the evidence of, I think, what a lot of us are feeling, which is, difficulty and high anxiety. So I just thought that, we all like statistics. I thought that would be really interesting for everybody to hear those stats.
Oh, thank you.
Absolutely.
Yeah. Oh, is that all? I'm happy to share them briefly. I'm a researcher, and I also work with a major safety net hospital and a major safety net behavioral health system in Kansas City. And so what the research shows from previous natural disasters, of which this is nothing even close to that, this pandemic, the research shows that there will definitely be a tsunami of mental health need in the community well after the pandemic is over, whenever that is. So especially when we talk about racial inequality and the most vulnerable and the most underserved, and reaching those people, it's even more important. There's also research that has shown that, and I can't remember if it's 1 or 5 or 1 in 8, but even if you've not had a pre-existing mental health condition, that people who have had COVID are more likely to develop a mental or behavioral problem after having COVID. There's also research out there that is showing that more people on the front line, like hospital staff, nurses, doctors, are going to need mental health support. So what I was talking about is, and the other piece of it is people with pre-existing conditions and the compounding effect of trauma needs to be taken into consideration when you think about the pandemic, as well as things, for example, like substance use have gone up across the board. So those are some of the things that we know. And thinking about the staffing shortages that existed prior to the pandemic, it's going to be really important to have resources for staffing and in order to meet the community mental health need, because we know it's coming in the future. So I think that was a couple points that I talked about.
Thank you, Sherry.
I thought our group discussion was probably the best, but just to summarize, because I didn't speak up, but we had a lot of good things, predominantly, the technology divide and how this has only exasperated that and highlighted it. And, having to also give self-care to the folks, and the way folks have shown resilience is, there was a couple good examples, like John Krasinski's Happy News. The Tri-County Mental Health Services group did a newsletter sharing positive things, did a diversity book club, helping to keep all those personal relationships alive. Another group within Tri-County Mental Health Services to overcome connecting with students. They stepped up their social media. They put up billboards. They did ads. They did mailers directly to families to stay connected. And let's see what else. A really cool, I thought was a really cool example was from the let's see, I'm sorry if I'm going to butcher this, but the Jewish Foundation, she gave it a really cool example. Maybe Melanie, you can expand on it, about taking some PCIT with earbud observation things directly into the home.
Yeah, just very quickly, we had been expanding pretty rapidly into pediatric counseling, and that need did not go away, but working with little ones virtually is difficult. And we were a couple of our counselors were really wary at first of trying to use virtual models with, kids under about probably 10 or 11. But what we found was using PCAT models and kind of adapting them to virtual models, we were able to get insight into family life that we otherwise probably wouldn't have gotten, and to adjust treatment plans based on that.
I hope you guys do some publishing on that. Are we just responding to the first question right now?
We can move on to the second question if folks would like to, definitely.
No, I just wanted to make sure because I really loved what our group was saying.
No, it's completely open. You can respond to any one of the three questions. It just would be helpful to have a conversation and share expertise among this group.
Michael Lumita, I'm the Chief Operating Officer at Healing House. We provide recovery housing in 13 residents, almost 200 beds a night. And what I shared in our group was the fact that we're finding a huge uptick in opioid issues. It's been around for a while. We've heard a lot of the problems moving westward from St. Louis, and we're almost beginning to feel like right now we're beginning to feel the impact. We've had 5 calls since Monday of individuals living in their cars and homeless, wanting to get into a program. And one of our challenges is finding a place for them to go to get a prescription of medication-assisted treatment. There's a long waiting list, and since we're not medical or clinical ourselves, we desperately need people to be stabilized before they can move into a residence with other people. We're still seeking answers for that, and any help we can get would be very, very wonderful, because normally these people are in crisis and they can't wait even another day before they're seen by somebody, and we're struggling to find resources to do that.
Michael, I'm just curious, pre-COVID, was there also a shortage of care, or is this for the opioid prescriptions?
I'm thinking this is new. We've heard so much of, I just heard a report on NPR this morning that said 42% of adults have reported in the census that they had experienced a bout of depression since COVID began. And I'm just thinking all of these factors are beginning to accelerate the problems with opioids here in Kansas City.
I was just going to make one comment. I'm Melissa Taylor with the Kansas City Friends of Alvin Ailey. And for those of you who know me, I don't want to sound like a broken record, but like with all this research, we're talking about the populations that will be hit the hardest are the underserved populations, adult and youth. And we know that those populations are high percentage people of color. And so I would just say we know that that's coming, so that organizations, take a look at your staff, people delivering the services, and do they look like those who will be most needing or wanting or coming for those mental health services.
We talked a little bit about some of the stuff that we're doing at Benilde. One of the things that we've worked on is getting a mental health coordinator. And what we've discovered that's doing is it's starting to break down some of the silos between our different organizations. Because if you think about the people we serve, especially in the inner city and stuff like that, for the most part, when they're trying to go to another program or something like that to get a full, complete amount of care, because no one program has it all, trying to jump through the hoops of those intakes and all the different requirements ends up raising the anxiety even more, especially now that half of it's, or 75% of it's digital. And it causes all kinds of problems. And I think if we could create more spots like the mental health coordinator that makes those connections, the position is designed specifically to take this person, walk them through the intake, say at SWOPE or Truman or any of your organizations, walk them through the intake, actually make sure that they have that next scheduled appointment. The amount of anxiety that the people we serve feel will drop immensely. And I think the quality of services across our entire community will raise. We already know that there's a lot of anxiety with people just trying to take that next step in recovery. I run a program that's substance use disorder on top of mental health issues, and the anxiety of trying to go get that next level of help. So they live with me for a while, they live at Benilde Hall for a while, and then they're going to go somewhere else. And that connection often fails, and that ends up showing the recidivism of why so many people come back, because there's not a real handoff to that next organization. And I think if we can find ways to increase those handoffs, increase the quality of services that go between one program to another, I think you'll see a difference in what we're doing. And honestly, with all the digital stuff, we should be able to do it even easier now than what we were doing before COVID kicked in.
And can you think of existing services that would be a natural fit to provide that, like a 211 or a government case social worker system, or something in existence that would have the most training to take on something like that?
Obviously, the different helplines would be good. At the same instance, I think it halfway comes down to kind of our programs doing it, because the mental health coordinator that I have specifically knows our guys, the ones that she's working with, and specifically knows what they need and going out and doing it. Does she need a better information base like that so she has a better way to reach out? Yes. But I think it really should come from us for the most part, because the people that work within your organizations know the people that you're serving. You know what they need. We just need to make sure that we're actually giving them a real handoff to what they need.
Ken, on that topic, we found very similar things with the warm handoff being almost essential. We have our primary care physicians upstairs and behavioral health is downstairs. But if there's not a warm handoff, even going downstairs, that anxiety, like you said, people don't want to go to the next step of behavioral health care, whether it's stigma, whether they think, whatever the reason, we can go into that. That's a whole nother conversation. But a lot of people don't want to do that next step. And the warm handoff, and we are currently working on a way to measure this, but we've seen it in our facility. We've seen it work, and we're working on ways to measure it so that we can quantify it and have data about that. But another thing that we do is we have these community health workers that They connect with other nonprofits, and they connect with other services, other healthcare services if we're unequipped to handle what the individual needs. And if anyone wants to get in touch with our health workers, please feel free to contact me. I'll put my email in the chat. If that's one of the big things in my role is to connect with nonprofits, so I'm happy to do it. I'll put my name and everything in the chat. Thank you. Sorry for my pitch.
Has there, Brad, have you guys, has there been exploration about, I know you need a diagnosis code for insurance and everything else to switch from primary care to behavioral health care, but has there been any work about thinking of renaming their needs in a way that might avoid that stigma?
Actually, that's one of the projects we've been working on. I've been working with our entire department of behavioral health. I am working on that language. We're working on exactly how that warm handoff works, because it only works if you say it the right way. We found that the language that works the best is, this is my colleague. If the physician says, this is my colleague, they don't try to avoid saying behavioral health or mental health immediately, and just say, this is my colleague who helps with these sorts of issues. They take a different approach. Do you mind if I bring them into the room? We'll talk, they can talk about maybe a different way to tackle your issue. Let's say somebody has a high A1C and they need a behavioral outcome or whatever to lower that so they don't get their diabetes worsened or whatever. We work on those kinds of behavioral outcomes for that too, as well as normal therapy for behavioral health issues. I feel like I'm plugging us too much now at this point.
I think, Brad, that's a really interesting system you have going there. I used to work for AAFP out here in Leawood, and there's definitely education needed among family docs in particular. They a lot of times would report that they could identify that, you know, a patient needed some kind of behavioral health and mental health assistance, but in many cases didn't know how to approach it, weren't comfortable approaching it, or just didn't know what resources were available. Even within their own systems, they didn't know what resources were available. I think being here with AAFP, you know, right up the road from a lot of us, I wonder if there's an opportunity to connect there too and provide resources to them.
That might be. I'm going to write that down.
I will add this, my mental health coordinator has bragged about the communication that we've created already with Sam Rogers. So really good job. Awesome. Just as an addition, our mental health coordinator is also a certified peer specialist. So they make a connection on a different level as well, which kind of helps open the door.
Glad to hear it.
In our last few minutes, can we spend some time talking about the question number 3? I don't know if any of the groups were able to get to it, but if anyone would like to add comments around looking forward and thinking about the Health Forward Mental Health Foundation Defined grant round, what components, parts, pieces would you like to recommend keeping moving into the future? What's been valuable to you?
I think if I summarize from our group, some things that, you know, kind of fall into the general operating support area that are soft things, but everyone seems to see them as very important from our group was funding prioritizing and funding the self-care of providers, figuring out how to overcome this dearth of providers in a very short-term fashion. And, you know, it seems like we need a lot of funding to figure that out very quickly based on the research we just heard, based on everything we all know, we see it. And then funding for the the training and the personnel for the knowledge of the community resources and the warm handoffs to ensure people aren't falling through the cracks and the recidivism, or however you say that. Those were the 3 biggies that I keep hearing over and over.
So I have a question. May I jump in? So I see in the chat, this is Dacia from Gateway of Hope, Dacia. And it says, is there a shortage of mental health professionals of color? I would say there is a growing number of African-American mental health professionals, but I tell you, to find a Latino mental health professional is like gold. And I was thinking this morning, I wonder if there is a way to also maybe nurture more Latino folks to, excuse me, to get into the mental health field. I mean, we have 2 people, we're very blessed to have 2 people who we're working with, but it took a long time to find them. And I am concerned about that community. So I just wanted to put that out there. I don't know if I mean, that's a big issue. I don't know if Health Forward is going to address that. I'm not sure how to, but I know it's a need.
I'm Lisa Rushmore. I'm a grant writer with Guadalupe Centers, and you can't have ours. Really, our staff talk about this constantly. We are very blessed to be able to offer our substance abuse groups in dual language, both Spanish and English, throughout Guadalupe Centers. Talk about and this is not the right area of interest grant, but our early educators are also dual language, and they are trying to retain our bilingual staff throughout the agency is just critical. Now, Guadalupe Centers does have a charter school, and they've tried to create some pathways into the nonprofit arena, into you know, mental health, into healthcare in general, education, et cetera, et cetera. But yeah, amen, what you said, yes. Hard to find and hard to keep because, especially, and I know this is not in the mental health field, but among early educators and our pre-K programs, they could make more money somewhere else. And same with our mental health providers and those who are working our substance abuse programs. So it is tough. But reach out to Guadalupe Centers if you want to do any sort of partnering. Yeah, I wish we could figure that out because they are needed and they are gold.
Gold.
If you need Spanish speaking LCSWs, we have 3 as well. So they're ours as well. So please do not, we're not giving them to you. But we could definitely see if there's somebody who needs to get on the schedule and needs to see someone who speaks Spanish.
Well, and maybe there is a conversation around collaborating. I know Pastor Sylvia at Center of Grace does a great job. She's got the Hispanic Task Force. I don't know. It's an issue. It's an issue in this community, and I think Health Forward would be a great thought leader in figuring out. I mean, it's very similar to how the dearth of African-American therapists, 10 years ago. When I first started, I think I was like 1 of 2 or 3 in the area. And I'm glad to see the growth. So, maybe there's something there.
I need to jump off, but I'm going to jump in really quick before I do that. So thank you, Susan, Dacia, and Lisa for mentioning this issue. One of the things that we'll prioritize exploring Health Forward's role in purpose alignment this year is that nexus between education, workforce, healthcare, and kind of health disparities or health injustice. Because we do know that there is a workforce issue in our entire safety net system, especially mental health, both with Black and Brown individuals being underrepresented as well as rural. So we will be exploring what our role is in terms of cultivating and filling gaps and getting to the point where we don't have gaps anymore in our system from this workforce perspective. So you've heard us talk about in our 15th anniversary and probably a few blogs, economic inclusion and race equity and the nexus of all of that. Here's a good nexus: education, workforce, healthcare development, pipelining. So we'll be exploring that.
And you know, it's interesting, a lot of the larger nonprofits nationwide are looking to public-private partnerships for this. Because, you know, of course, they've got a lot more funding than we do. So I don't know. I don't know if that's, you know, just need to keep that government partner as well in this.
Yeah, I agree. I think public-private and philanthropic partnerships are really the only path forward for common agenda setting and kind of pooled assets and funding for systemic change. Governor Parson in his State of the Union address last week spoke about a lot of workforce development. So I think there's also bi-state workforce development partnership opportunities, healthcare and otherwise, but specifically for our purposes, healthcare, that we'll be exploring.
So we want to be thoughtful of everyone's time. We're scheduled to end at 11. So if there's no further comments, I'm going to start wrapping up and thanking everyone for taking your time. We know you're busy, and we know coming back after a 5-minute break was a choice. So we appreciate you participating in this second part of the programming, and hope to talk to you soon about your proposals, and even more hope that we'll be able to convene and see each other in person as soon as possible. So stay well and healthy, and thank you for joining us.